Well, new at 6, we've been telling you about the dire lack of treatment in Colorado for kids with severe mental health issues. Parents are abandoning their kids in emergency rooms just to get help.
Tonight, we're learning more about why the state is in this crisis and what it will take to get out of it. Our Sean Boyd continues her coverage of this important issue for us tonight. And Sean, families are desperate.
Michael, I've heard from them. Parents, grandparents, providers, too. Hundreds of kids in Colorado need treatment and can't get it. So they are going out of state or spending weeks in county offices. While the legislature has approved millions of dollars to help, the truth is it will take millions more to meet the need.
Why did you write me?
Because we want help.
I receive hundreds of emails on any given week, but the email I receive from Stephen Johnson is the kind you don't forget. We are at the end of our rope, the 77-year-old told me. He and his wife were raising their 16-year-old grandson, who he said had been in 5 mental health hospitals. As soon as funds run dry, he explained, kids are declared safe enough to go home. This time, he said, he had refused to take his grandson back.
He got more violent this last time home. He punched a hole in his bedroom wall. There's scar tissue up and down both arms, slices. His safety and our safety is at risk.
Johnson not alone. In email after email, parents told of kids who were dangerous, destructive, and had been failed by the state, describing an abysmal lack of services. Providers, too, wrote of kids dumped in ERs, of staff burnout, saying it's unacceptable, inhumane, and appalling.
These kids haven't got a prayer.
How long has this been going on, and how did we get to this point?
Minna Castilla Cohen, director of the Colorado Office of Youth, Children, and Families. She says the lack of residential treatment is primarily due to a lack of providers specialized in complex cases.
We are seeing, especially in the last couple of years, a new population of young people who perhaps have needs that are much more acute than we've seen before. We have open beds. Some of them aren't staffed, which is why we can't utilize them. Some of them aren't specialized.
And that won't change, she says, unless the state is willing to pay more. Based on an actuarial analysis, Colorado should be paying $700 per kid per day. Instead, it pays $320. Complex cases are even more expensive. Based on a pilot program, Cohen says the cost of care in those cases runs $1,600 per kid per day for 6 months.
I do think that there are providers in our state who want to expand if the payment structure was right. And I do believe that we have some providers out of state who are interested in serving in Colorado as well.
But she says it will take many millions of dollars and likely years to meet the need.
We are singularly focused at this time on really working towards solutions.
Stephen Johnson says he needs help now. His grandson is getting worse, he says, and he's not getting any younger.
Yes, my golden years aren't quite so golden.
As I reported earlier this week, human services directors across the state are calling on Governor Polis to step in, saying it is a crisis. I've asked the governor to talk about it. He has declined at this point. The governor's last budget request was for a 0.5% increase in provider rates. While the legislature did bump that up to 3%, it is still not even close to what analysis shows is needed. And yet, the state is pushing forward with a new multi-million-dollar psychiatric facility at Fort Logan, even though it can't staff the beds it has now. Live at the Capitol, Sean Boyd covering Colorado First.
Thank you, Sean. Now, Sean has done a series of stories about this critical issue. You can find all of those stories on our website, cbscolorado.com.